So vasectomy is intended to be a permanent form of male sterilization. Options for fertility after your vasectomy are available, but they can be costly and they don't always have the best outcomes, so you want to make sure that you're ready for your vasectomy when you decide to have your procedure. Vasectomy has no outcomes on sexual function or performance. The goal of vasectomy is just to make sure that there are no sperm in your actual semen, but functionally there is no change. Our vasectomies are usually done in our procedure center. The procedure will usually take up to 30 minutes. There's no prepping at home that you need to do prior to your procedure. Everything will be taken care of at the Urology Center. We've been doing the non-scalpel technique for many years, and all the providers are very well versed in doing this procedure. So the no-scalpel technique is a minimally invasive way that we perform a vasectomy that decreases your risk factors for complications afterwards. Vasectomy is performed under local anesthesia. It is highly recommended that you have a driver after your procedure. Postoperative discomfort after vasectomy can easily be controlled with over-the-counter medications such as Tylenol or ibuprofen. But some patients may require a prescription for a stronger pain medication, and they'll have to have that discussion with their physician. The risks to a vasectomy are very minimal, but they do include some scrotal bruising and swelling. And sometimes a blood pocket can develop, which we call a hematoma. That occurs approximately 1 to 2% of the time. In regards to preventing bruising and swelling, we recommend that you take at least 2 days off from your procedure. And then for the next week, you really want to take it easy. If you have to think to yourself, should I be doing something, you probably shouldn't. So you want to avoid the gym, avoid sexual activity, avoid lifting heavy objects for approximately 1 week afterwards. The other risks include infection, like any other procedure, which is approximately 1 to 2% as well. If you get symptoms such as fevers or chills or a drainage that looks infected, then you want to give us a call right away. The last risk that patients should really take into consideration is chronic pain, and this happens approximately 1 to 2% of the time afterwards, but it is something that you should know about just in case it happens to you. After your procedure, you're going to want to wear some sort of scrotal support. Now, this can just be tight underwear, but it will help prevent some of the risks such as swelling and bruising. Also, you can use ice for 20 minutes on, 20 minutes off to help soothe any discomfort and help prevent swelling. Now, following a vasectomy, for approximately 3 months afterwards, you and your partner still need to use contraception because there are still live sperm in your system and you can actually still get pregnant during that time period. Even after your vasectomy, there is a 1 in 2,000 chance that you and your partner may become pregnant, even after you have a negative semen analysis. Vasectomy is an elective procedure, but it is covered by most insurance carriers. Now, if it is not covered by your insurance provider, then our billing department can help make arrangements and discuss how much the procedure is going to cost. So if you're ready to proceed with a vasectomy or you have any other questions, please give our office a call.